So I had just a couple of stories to share, and the first one was kind of I was reminded of it when people were talking about taxpayers' dollars going to pay for state insurance, going to pay for that wonderful Cadillac coverage that state employees get. Well, I'm the daughter of a state employee, and back maybe 3 or 4 years ago, maybe a little longer than that, I think, I had to get a tooth extracted. And I was one of the lucky ones that, since we had the good Cadillac coverage, they covered the anesthesia, since I have asthma and, can't have the mask over my face. So the doctor gets in there, and it turns out it was a good thing that I needed to be put out, because there was a complication during it, and they ended up having to make an incision and actually surgically extract the tooth instead of just pulling it. So I thought, no big deal. I've got this great state insurance, Cadillac coverage. The insurance bill came back, and they wouldn't cover the surgery part of it. And I called them and said, what's going on? You guys said that you were going to cover this. And they said, well, the doctor told us it was just going to be an extraction. They didn't say it was going to be, a surgical thing. I mean, what was the doctor supposed to do? Stop the surgery and say, I know it was supposed to be an extraction, but something's come up. Can I still take this out? I mean, it was like you were saying, the doctor needs to be the one to decide our care, and right now they can't, even under this wonderful state insurance that we're paying for. The other thing that I wanted to share was related to mental health, and that is learning disabilities. I grew up with an undiagnosed learning disability. It was not diagnosed until college. And it, come to find out that it was because the school didn't want to pay for it. Because, if the school says that there's a problem, the school has to pay for the testing, which, by the way, is psychological testing, so that's medical. That would be covered under HB 311. There's another cost that the schools wouldn't have to pay for. So, I grew up as a mostly C student and got into college, almost failed out in my first year, and then we discovered the learning disability. I was diagnosed, I got the services that I needed, and really it wasn't much. I tape recorded lectures, and I got a little extra time on tests in a low distraction environment. That was all I needed, and I went from being a C student to being on the dean's list. So, I mean, these are just simple little things, and I was talking to a friend of mine, I hope she doesn't mind that I name her, but it was Heidi, and I was telling her my story, and I said, I know that it's not a horror story, and she said, you know what, stop right there. She said, it is a horror story. It may be minor, and you may be a lucky one, but you have done everything right. I've been to college, I graduated, my husband's working full-time, I'm only working part-time due to health issues that, by the way, would be solved by a prescription that would only cost $100 a month, but I can't afford. And, I've done what supposedly you're supposed to get the American dream, and somehow I don't have it, and it all traces back to access to health care. So I'm so glad that Representative Flowers and Representative Chaplabia and the other, 90 co-sponsors? Or not 90,
we're not
no.
up there
I'm
yet.
thinking the hospital.
That's
I'm thinking of the U.S. House.
Optimistic, yes.
I'm thinking of the U.S. House. How many co-sponsors?
We have about 25, something like that. We're working on it.
Good. So, I mean, I'm so glad that they are on board with this, and I just really implore the other representatives to get on board with this, and unfortunately, neither of these wonderful women are my representative, but you can bet that I will be calling Mr. Pritchard and
Yeah.
talking to him about it.